Today, the Maine CDC gave an update on its pandemic response. These are the 3 things you need to know. First up, the Omicron variant. You've likely heard about it by now. The first confirmed case is in California. Maine is actively sequencing positive samples to see when the variant appears in our state. During today's briefing, Maine CDC Director Dr. Nirav Shah addressed the most common questions about the variant, including, is it more contagious than other variants? Does it cause more severe symptoms that would lead to hospitalization? And the big one, how much can the current vaccines protect us from Omicron? Overall, the answer to all 3 of these questions is we need more data to get an accurate picture, even as it relates to vaccine protection.
That's the scientific question that's underway right now. And some virologists and immunologists with whom I've had the opportunity to speak just in the past couple of days have suggested that our body's immune system is so remarkably resilient that they believe that there will be some degree of protection from the current vaccines. Just how high degree of protection that is, that's the question on the table.
Dr. Shah says it is more critical now than ever to wear a mask indoors in public places and get the vaccine or a booster. He says we cannot forget about the Delta variant, which is what's causing these records in the hospitals. Okay, number 2, a new record of people in the hospital with the virus. 334 people. 99 people are in intensive care. 49 are on a ventilator. That's also a record. Maine's public health leaders expect these numbers will go up in the next few weeks due to Thanksgiving gatherings. But here's one big problem. The workforce shortage at nursing facilities means those locations cannot take in more people. That means people who need that level of care are staying at the hospital to get it. DHHS Commissioner Jean Lambrew said the state is working with some hospitals to shift staff to those nursing facilities to open up hospital beds for COVID patients.
I mean, we're no longer in the planning phase. We are in the execution phase because we have seen these record high numbers of people in Maine hospitals with COVID-19. We have been working with our hospitals primarily because the hospital capacity is high, as well as with our nursing facilities, to really try to load balance out our patients in Maine.
Commissioner Lambrew says the state plans to intensify efforts with those hospitals and nursing facilities in the very near future. And third, if you're having trouble getting an appointment for your COVID-19 booster shot, you are not alone. Dr. Shah said he has heard these concerns of people having appointments canceled at the last minute. Shah encourages people to go to either the York County Emergency Management site in Sanford or the site at the Auburn Mall. He said those sites have been doing up to 700 shots per day. He said the major problem for people trying to get their boosters has been pharmacies not having enough staff, particularly Walgreens.
So we know the demand is out there. We've heard those concerns and we're working to address them.
Dr. Shah said the state is working to offer more one-off, large-scale pop-up clinics too, like the one at a McDonald's in Waterville last week that administered 200 shots. He says anyone 18 and older should get a vaccine, particularly a booster. Those are the 3 things you need to know from today's CDC briefing.